Hello, my name is Darcy Dremmons from Ohio Christian University, and this report is on CTE causes, symptoms, and treatments. So what is CTE? CTE stands for chronic traumatic encephalopathy. This is a degenerative brain disease, and it's linked to repeated traumatic brain injuries, or otherwise known as concussions. CTE is an abnormal buildup of a protein called tau. When the tau forms clumps and masses in the temporal and frontal lobes, this disturbs the brain function. I am sure we've all heard of a concussion, but just to review, a concussion is defined as a complex pathophysiological process that affects the brain and is induced by traumatic biochemical forces. So basically, any blow to the head, neck, or face, or even the body can jar the brain and cause injury. On the subject of concussions, there are 3 grades of concussions. There's a grade 1, grade 2, and grade 3. Grade 1 being the least severe, grade 3 being the most. Grades 1 and grades 2, they all share symptoms. However, the severity of the symptoms are how the grades or the levels get determined. Some of the general symptoms include confusion, clumsiness, slurred speech, sensitivity to light, sensitivity to sound, behavior changes, difficulty concentrating, sleepiness, memory loss, nausea, just a few of the general symptoms. So if those symptoms are lasting for less than 15 minutes, we're looking at a grade 1 concussion. If they last longer than 15 minutes, we're looking at a grade 2. And then for a grade 3, you can lose consciousness for up to 30 minutes, and those symptoms can include a skull fracture or depression, and they can last for up to 24 hours. Who is affected by CTE? I had always associated this with football players. That's what you hear about. Football players committing murder, acts of violence, domestic violence, drug and alcohol problems, general issues with authority. However, any athlete suffering from repeated blows to the body or head is at risk. Military personnel, we've talked about that. We've talked about those who experience violence from intimate partners, from parents, from family, from bullying. And then there's also anybody who's been diagnosed with a concussion has a potential to have those tau formations created in their head. So nobody is really in the clear. How is CTE diagnosed and what is the treatment? This one is where things get a little tricky because officially CTE can only be diagnosed posthumously on a dead person's brain. Has to be dissected, cut open, studied, looked at under a microscope, looked at under lights. However, with science and technology evolving rapidly, daily it seems, there are several studies taking place looking at ways to diagnose this in living subjects. UCLA in 2012 discovered that you could possibly see that tau buildup on a brain by injecting these tracers into a living subject. And they follow these tracers using a PET scan, and they are able to see where these tracers stop and are attracted to this protein in the brain. And they can see whether that protein is spread out in a healthy manner or if it has started to form clumps and masses. So they're thinking that by doing this, they can tell whether a living person is suffering from CTE. And since there is no diagnosis, there really isn't an official one treatment cures all. However, we've talked about some of the symptoms: depression, mood swings, emotional instability, impulsiveness, higher order thinking issues. We can treat those symptoms. We can treat depression. We can teach people coping skills. you can treat pain, physical pain. So all hope isn't lost, and I think the more technology advances and the more the medical field advances, the more we're going to be able to learn about CTE. So as I mentioned earlier, football players are a sought-after demographic for the research of CTE. We know that CTE is caused by recurring head injuries. We know that athletes such as soccer, hockey, football, boxing, they are the highest risk for contracting this disease. About 20% of all the subjects have struggled with drug abuse at some point in history, whether that's alcohol, drugs, painkillers, marijuana, really any substance. And so I do see a lot more research happening in the future on that. And we talked earlier about how the shockwave from an explosion can equal the effect of multiple concussions. So those military personnel are at a very high risk of having CTE. A couple more surveys here. The soccer parent survey was done on parents of soccer players ranging in age from elementary school up to college. And they were given a couple of scenarios, and they were asked to rate these scenarios on a mild, moderate, or major impact on whether or not they would allow their children to continue playing the sport. So when asked about the severity of a concussion, 82% said that would majorly impact their decision. When asked about the number of concussions, 84% said that was a major player in whether or not their child was allowed to continue the sport. And then the age of the child, the level of play, and whether or not the athletes lose consciousness. So those were just some different things they were asked. And then in the Vets and Athletes study, they studied the brains of 4 athletes and 4 veterans post-mortem. And again, this kind of reconfirms what we talked about a little bit earlier, that one blast equals multiple concussions. And they are seeing that now. They can tell now. So they're working on ways to help both veterans and athletes now, and not just football players or boxers. We've already touched on the symptoms of CTE a little bit. They do mirror those of the traumatic brain injury: headache, short-term memory lapse, impaired attention span, inability to multitask, emotional instability. Some could have tremors, the inability to solve problems, lack of organization, or difficulty with higher order thinking. Those are all symptoms of CTE. Some of the more well-known cases of CTE come from football players. NFL players Junior Seau, Dave Duerson, Aaron Hernandez. There was also the University of Pennsylvania lineman who committed suicide named Owen Thomas, who was 21 years old and who had never been officially diagnosed with a concussion. So that's a little scary too. All 4 of these people have officially been diagnosed with CTE postmortem. Their brains were all studied and they were all confirmed cases. Aaron Hernandez is considered the worst case of CTE in a 27-year-old they've ever seen. They said his brain looked more like a 60-year-old's brain who had been playing contact sports his whole life. With the NFL being the focus of a lot of controversy revolving around concussions and CTE, they are taking steps to try to protect their players. I mean, that's the ultimate goal, I think. We've got the Gladiator helmet. It has a soft exterior and a car bumper leg interior. And then this Riddell has sensors in it so they can measure the force that a player is hit with. However, yes, we're protecting the head, but is the brain really protected? Your body is still jerking. Your brain is still bouncing off the inside of your skull. So I think these might help a little bit, but in my non-scientific mind, I don't really see how a different helmet is going to make that big of a difference. To wrap this presentation up, here's a quote that reminds us that concussions are more than just a one-time event. It says, TBI is more of a disease process than of an event that is associated with immediate and long-term sensomotor, psychological, and cognitive impairments. It's just a good reminder that we need to take care of our brains.